In this video, you're going to learn if structured literacy intervention is enough for kids with dyslexia. Although this information has been around since 2000, the science of reading has become a large newsworthy topic in 2023 with the release of the Soul to Story podcast by Emily Hanford, where she unveils the breakdown occurring in literacy instruction in our nation's public schools. In her podcast, she shed a light on the difference between structured literacy, which is research-based, explicit instructional methods for reading and spelling based on the science of reading, and balanced literacy, which is a commonly used approach in our nation's public schools for over the last 20 years. She connects the breakdown in our literacy crisis to this, and everything she is saying is correct. But if a top-down change were to occur and the American educational system converted their instructional methods to that of a structured literacy approach, would this help our students with dyslexia? The answer is yes, but it also would not be enough. A large component of what we do as academic language therapists is based in the principles of structured literacy. We were structured literacy before structured literacy became cool. So much of the study that we do as certified academic language therapists is the explicit and systematic educational instructional methods of structured literacy, since this is a large piece of the cornerstone of dyslexia therapy. In fact, you would say that we're structured literacy experts. The black and white rule-based reasoning of a structured literacy approach is exactly what the dyslexic brain needs as a toolkit for successful decoding and encoding. But when conducting dyslexia therapy, our goal is to connect and create the needed neural pathways in the dyslexic brain for long-term automatic application for our students. This occurs both with a combination of structured literacy and multisensory, in other words, Orton-Gillingham, activities. This is why structured literacy instruction is not enough for students with dyslexia. While it does help them tremendously, in order to create long-term success, we need to incorporate multisensory techniques, connecting the kinesthetic, auditory, and visual aspects in order to truly treat students with dyslexia. Lastly, this multisensory structured literacy instruction must be high repetition, continually revisiting these concepts to build solid pathways for the brain to begin to access them automatically without having to concentrate and apply the techniques consciously. It is like anything that you do to practice. The more touches you have with the guitar, the more that your brain just does the moves without you actively having to think about each step. The same can be said for reading and spelling. As someone widely connected into the current educational system, I can tell you that more and more schools are taking it upon themselves to begin to incorporate the principles of the science of reading and structured literacy and move away from balanced literacy. This is great news for the general population of students, as it will secure increased reading proficiency rates in the future and greater reading and spelling success for our nation's children. But I'm seeing intervention plans for our children with dyslexia exclusively based in structured literacy, forgetting the essential Orton-Gillingham component needed for long-term results. As a parent, when establishing the intervention plan with your child's school through the IEP process, make sure that the school's plan includes both structured literacy and done in a multisensory, or in other words, Orton-Gillingham approach. Secondly, make sure that you request that someone highly trained and certified in dyslexia, such as a certified academic language therapist or certified Orton-Gillingham, be providing that instruction to your child. With this equation, you can be assured of a greater level of success with the school-based intervention plan. When you work with Dyslexia on Demand, you can trust that our expertise, individualization, and therapeutic programming set us apart. Our expert counts keep a steady eye on student progress through qualitative feedback and quantitative progress monitoring to provide tailored instruction to each student's needs. All of our norm reference dyslexia determinations and progress monitoring are completed by a testing professional who is both a diagnostician and a certified academic language therapist. This ensures that we have a dyslexia expert eye completing all evaluations, gauging growth, and providing specific and effective recommendations for each student's instruction according to skill. Please visit us at dyslexiaondemand.com to schedule a personal meeting with me to learn more about how we can change the life of your child. And also, please like and follow for more educational videos such as this one.